Well, one of the issues we're talking about there was this decision to extend the gap between vaccine doses up to 12 weeks. Now, it does worry several groups, including the Doctors Association, and we can talk to one of their members, our GP, Rosie Shire. Good to see you this morning. Look, the Health Secretary there saying they'd rather give people sort of 50% protection and get more people out there protected rather than get everyone doubled up with their doses. Why, as a plan, does that not work for you?
Good morning, Stephen. On behalf of the Doctors Association UK, thank you for having me on the programme. We're really concerned by this decision to extend the vaccination schedule for the Pfizer vaccination from what was studied when they designed the vaccination, which was that people would have 2 doses of the Pfizer vaccination 3 weeks apart, and that showed that it gave them 90% immunity, to then extend this to give them 2 doses 12 weeks apart. And what really concerns us is we don't know what happens if you don't give that second dose of vaccination after 3 weeks.
And yet, you're quite right, and in a sense, no one is claiming at this stage that they do know, but the Health Secretary and some others, including some of the scientific advisors, saying, well, even with that uncertainty, to get people some level of immunity is more important.
It would be great if we could say, yes, they're going to have some level of immunity that will continue after that 3-week dose. But think about the worst case scenario, that after 3 weeks, that immunity just wanes completely. Or maybe if we then give the booster at 12 weeks, that's just not good enough. The fact is that people are being vaccinated now, and they're being put into what is effectively an unregulated, unlicensed trial, whereby they're receiving this vaccination on the understanding that then they don't know what's going on. And on the ground, that's really hard for us as GPs, as vaccinators, to have to explain that to people so that they fully understand the implications of what's going on. If we give them the Oxford vaccination, we can say to them, you will get your second dose in 12 weeks' time, and that's what the study did, and they show that you get this level of immunity after that. With the Pfizer vaccination, when we give that, we're having to say to people, you're going to get some immunity, and we don't know what's going to happen after that 3-week period because it hasn't been looked at. And you're going to have to then wait till 12 weeks, and we hope it's going to be 12 weeks because the rules were suddenly changed when in December, when we first started vaccinating, we told these people you were getting your second dose in 3 weeks, and suddenly we had to cancel all these second doses. So we just need more information to be able to tell people so that they understand the risk that we're having to go through at the moment.
But the Chief Medical Officer, Chris Whitty, has said, this is it's a public health decision, and he thinks it's a reasonable thing to do because, in his words, our major limitation of the number of vaccines we actually have to give. It's not the ability to vaccinate, it's a number of vaccines that have to be given. So in terms of public health, he thinks it's worth the risk.
They've obviously looked into this, and it's reassuring to know. I think that they have looked at it, but we don't know all the data around this. We don't know what's been considered. And we're the ones on the ground who are actually talking to people about the vaccination. And we're the ones that are having to take the consent. And when we talk about consent, we always talk about informed consent, so people understand the risks and the benefits to a procedure or a vaccination. I also think it's really important just to mention here that we're hearing a lot of statistics about 3/4 of over 80s have been vaccinated. Well, actually, no, they haven't been. 3/4 of over 80-year-olds have received their first dose of the vaccination, and they're not going to be fully vaccinated until they've received that second dose. And if they've had the Pfizer vaccination, we don't know if they are going to be fully vaccinated when they receive the second dose, because that schedule has been changed from what was studied and what was licensed.
Is there a logistical issue from a sort of GP perspective in keeping track of people over a minimum of a 3-month period to get them back in for a second dose?
So at the moment, everything is recorded onto a system called Pinnacle, and then that gets uploaded onto the patient's records. it is a potential logistical problem of having to phone people again. When we initially gave the Pfizer in December, we could say to people, this is your Pfizer vaccination. Please come back in 3 weeks' time, same place, and you'll get your second vaccination. And that was great. That was really easy for people to understand. And it didn't take the manpower, the people on the phones, phoning people up. Now, with this 3-month gap, we're going to have to get everybody back on the phone, phoning all those 5 million people to say, please, can you come back to have your second vaccination at this time, this place? Another issue we're having is knowing what vaccinations we're getting and when we're getting them. We're not seeing much transparency about the delivery schedule and the supply chains. So we can only book people in a week in advance. If we knew more what we were going to get, and we could have guarantees of how many vaccinations we were going to get, and also which type of vaccination we were going to get, we would be able to plan much more efficiently and hopefully increase the vaccinating.
Dr. Shire, good to talk to you this morning. Thank you. Well,